Hi Lou, how are you doing today?
Very good. How about you?
Good, not too bad. So what brings you in today?
Just for my annual checkup.
Okay, can you just verify your name and date of birth for me?
Lou Ann Halligan, 11/17/64.
Okay, and how old are you?
55.
Okay. And what's the year?
2020.
What's the month?
October.
And then who's the president?
Donald Trump.
Okay. All right. So alert oriented ×4. I'm just gonna ask you a couple questions right now about your past history. So, any past skin disease?
No.
Any change in skin pigmentation?
No.
Any changes in your moles on your skin since
No.
your last visit?
No, there have not been.
Okay. Any dryness or moisture?
No.
Skin itchiness?
No.
Excessive bruising?
No.
Any skin rash or lesions?
No.
What medications are you on?
I take Zyrtec over the counter at night. For just seasonal allergies.
Any recent hair loss?
No.
Change in nails?
No.
Any environmental reasons that were hazardous to your skin?
No.
And then, do you take care of your skin? You wear sunscreen, moisturize?
Yes, I try to be pretty good.
Okay. And how much sun exposure do you have? Do you wear long sleeves? Are you covered for the most part? Wear a hat?
Definitely a hat, and attempt to wear long sleeves unless it's too hot.
Okay. Have you had any severe headaches recently?
I have not.
No. Any head injury?
No.
Dizziness when you stand up or when you lay down or anything like that?
No.
Neck pain?
No.
Notice any lumps or swelling in the head or the neck?
No.
Have you had surgery?
No.
No? Okay, so now I'm just going to do an assessment on you. I'm going to sanitize my hands. Alright, I'm just going to see your skin. I'm going to palpate it. It's pink, reactive. Okay, so we're good on that. Temperature, not too hot, we're good. Okay, and then I'm going to check out your hair and see how you're doing. You didn't notice any bumps or anything bothering you up there?
No.
Putting the gloves on, checking for any infection. No? Okay, looks good. Can you smile for me? Frown. Can you blow your face like? Okay. Let's sanitize my hands again. When you open your mouth for me and close it, any popping?
No.
No? Doesn't hurt when you're opening or closing?
No.
Okay, I'm going to go from behind your neck and feel for a lymph nodes. No, good. Okay, I'm going to feel your carotid. Other side. Your temporal. Okay, good. Alright, can you squeeze my hands for me? Okay, press against them. Press against them. Okay, now with your legs. Kick this one up. Press against. Okay, now push against. Okay, other one. Okay, good. All right. I'm going to check for your thyroid glands also. No issues with those that you noticed?
No.
No? Okay, they look good. Okay, so now I am going to check some of your nerve functions just to make sure that you are responding well with eyes and everything like that. Have you had any issues with your eyes?
No.
No? Okay, so first I just want you to follow this with your eyes. Don't move your head, okay? Okay, good. And now I'm going to cover one side. Follow the light. Good. The other side. Good. Okay. Now I'm going to go behind your ear and whisper something to you. What do they say?
Red.
Okay. On the other side.
Dogs.
Okay, good. And once again, will you blow? Okay, good. And then, can you stick out your tongue for me? Good, equal. All right. Shrug your shoulders. Good. Does that hurt?
No.
No? Okay. And then you stuck out your tongue. Okay, good. And then, all right, Miss Lillian, do you have any questions for me?
Nope, I think I'm good. Thank you.
Actually, one more test before I go. I want you to close your eyes and point to where you feel. Okay, good. And then, okay, I want you to smell this. What does this smell like?
Mint.
Okay, good. All right, do you have any questions for me?
I do not.
Okay, well, we'll see you in about 6 months unless anything changes, okay?
That sounds good. Thank you.
Have a great day.